Hi everyone, welcome to my channel Capsule. Today's topic is Haemophilus influenzae. Okay, so Haemophilus influenzae is a gram-negative cocci. Gram-negative means when we are using gram staining, it shows the pink color or red color. Okay, and which kind of cocci? Actually, it stays in diplococci. It means two cocci, two round cocci present together. Okay, and it is an facultative anaerobes. What do you understand by facultative anaerobes? It means they actually prefer to live in presence of oxygen but also can survive if there is absence of oxygen. Okay, so this kind of facultative anaerobes which comes in our mind, that is E. coli or Escherichia coli. Okay, now next point is capsule part shows the virulence factor. Obviously, the capsule part of any kind of microorganisms or bacteria obviously shows the virulence nature. And in this case, particularly a component which is present in the capsule part, that is Polyribosyl Ribitol Phosphate or PRP. This ingredient actually responsible for the virulence factor. Okay, so the main virulent strain which is responsible for the infection of Haemophilus influenzae, that is type B or HIB or Haemophilus influenzae type B. Okay, now interesting factor that it has an enzyme, specific enzyme which can cleave the specific peptide bonds in human immunoglobulin A. It means it affects mainly IgA type of antibody by breaking the peptide bonds and eliminates the Fc fragment of this antibody already bound. Clear? Now the next topic is what are the risk factors or which kind of patients are affected by it. Okay, so the patients with the age under 18 years old and the patients which are not vaccinated or unvaccinated and the patient which are suffering from sickle cell anemia or sickle cell disease mainly affected by it. Okay, because they have low immunity power, that's why they will affect it. Now how they transmit? They actually transmit through respiratory droplets. Okay, and now what are the symptoms when you are suffering from Haemophilus influenzae infection? What kind of sign and symptoms you will see in you? Okay, so that are acute rhinosinusitis. Rhino means, that means nose. Okay, sino comes from sinus and itis comes from inflammation. It means inflammation of the sinus membrane, mucous membrane of the sinus in the nose, that is rhinosinusitis. Okay, now second one is epiglottitis. Epiglottis is the small movable lead type part just above the larynx that prevents the food and drink from entering into the windpipe, that is epiglottis. So if there is an inflammation, because the part itis always represents inflammation nature. Okay, so if there is an inflammation condition of epiglottis, that is epiglottitis. Meningitis means obviously the inflammation of meninges. Septic arthritis means your joint infection, and otitis media, also known as middle ear infection. Okay, so these are the sign and symptoms. Now what should be the treatment? So the treatment is conjugated vaccine, ceftriaxone as a medicine, rifampin or rifampicin as a medicine. Now what is conjugated vaccine? Actually this is a kind of vaccine which is also known as HIV vaccine, this vaccine actually, I have said that a component that is polyribosyl ribitol phosphate or PRP that is present in the capsule, that ingredient actually can form a conjugate with any kind of antigen. Now for this purpose, to make conjugate vaccine, the antigen which are used to form a conjugate with the PRP, that type of antigens are antigen which are obtained from Neisseria meningitis. TDs. Okay, this kind of, or it is tetanus toxins. Okay, so the antigen which we obtained from N meningitidis or tetanus toxins, this kind of antigen will bind with the PRP ingredient which are present in the capsule part, and that kind of vaccine is formed. That is called conjugated vaccine. Okay, so hope you will enjoy the lecture. If you like my video, please do like, comment, share and subscribe to grow Capsule. Thank you for your attention.